Hello, I'm Victor Mark, and I'm going to make the introduction for our honored speaker today, Dr. Hon Yuen, originally from Hong Kong, who is a professor of occupational therapy, trained at the University of Queensland, Australia, then came to Western Michigan University, and had been trained in research evaluation and measurement methods from the University of Florida, where I used to work also, in Gainesville, Florida. Came to UAB 13 years ago from the Medical University of South Carolina, and is a professor and director of research in the Department of OT here at the School of Health Professions at UAB. He has very diverse research interests, ranging from early work on oral health among people with spinal cord injury to more recent focus on the arts in medicine. Today we'll learn about his work in creating writing for healing in people with spinal cord injury. And so we're very grateful to have Dr. Yuen here. And so we gladly welcome here. Thank you for your attention.
Thank you for letting me to come and talk about one of my research projects. And this research project is funded by the Christopher and Dana Reed Foundations. It's a small pilot study, and it's not a quote-unquote research study, but we'll show it to you what the results looks like. Some of the background about our study is, as you all know, after spinal cord injury, the people that often experience grief as a result of the loss of physical mobility, social and occupational role functions, and basically the identity is lost, and the life goal is all gone. I mean, most of the time, and grief is often a burdensome and cause intensive emotional suffering and negative impact on an individual's quality of life. And grieving associated with loss after spinal cord is different from bereavements in that the disability from the spinal cord injury is a lifelong reminder of a person's loss. I mean, there's no way you can forget it, because every day, basically, you wake up that, and if you can't move your limb, then you can't. I mean, it's not like you can forget that. A grieving process related to spinal cord injuries, not only individualized, but it's also complex as any other types of grieving process, I'm sure. And it also involved highs and lows and change over times, and so it's not linear fashions, and reverberating and iterative trajectory across the different stage of the grief. And those unresolved emotions of grief will likely to reserve when people with spinal cord injury are confronted with complications of the injury, like cupiditis or UTI or other additional health issues, and or architectural barriers, and as well as psychosocial stressors such as disability discriminations. Therefore, people that with spinal cord is often viewed grief as something they must cope with every day. I mean, it's not, as I say, it's not something that they can forget it after a certain time, and they will live with them for the rest of their life. And at the same time, oftentimes they avoid talking about the feelings of grief. Okay, and which may not be the best strategies, and because by holding back as one's feelings, it can leading to more grief over time. In a way that's good, with increase of evidence of suggested creative art can help decrease the symptoms of emotional distress and facilitate the progress through grieving process, both of which that can help people with chronic conditions to adjust better to their changed lives. And then even for a lot of people, I mean, this kind of expressive writing or creative arts have been done for years. I mean, I will let you know them with that. Not necessarily for spinal cord, but have been done for people who have lost their loved ones. Okay, that have been done for probably more than closer to 50 or even longer. Expressive writing is a psychological intervention in which people write about their thoughts and emotions and experience to the internal process and healing from traumatic or stressful life events. This therapeutic technique is sometimes called the writing to heal. Okay, and most of people probably done that after traumatic events or loss of a loved one, and it does help. Okay, to reduce it, the intensity of the grief. Research have done over the last 40 years to establish that people with chronic conditions and they gain benefit from writing about their emotionally traumatic or stressful life experience. Okay. And there have been lots of studies have been done in rheumatoid arthritis, diabetes, and cancer, and patients, and that can help them to improve the health status and well-being. And a meta-analysis also have been done showing that adults who experience a traumatic event and engage in expressive writing, and then to express the feelings and emotions about the event that leading to their traumas or the loss, and show the improvement, about 23% improvement in health, both physical as well as psychological, compared to individuals just writing for some kind of neutral event or some trivial things, just like writing about describe this room, something like that. Although that expressive writing that has the potential to benefit people with spinal cord injury, that can support their grief journey and promote the psychosocial health. That, to our knowledge, we try to find literature that have been done in this area, but I have hard time to find it. Any kind of literature that's related to grief as the expressive writing that can help reduce it, the intensity of grief, or have to support the grief journey in people with physical disability, not to mention about spinal cord injuries. And therefore, I kind of submit a grant to Christopher and Dana with Foundation. It's a community grant. It's not a research grant, and I just throw these ideas and then see whether they will fund us. And then and most of the time that they only fund kind of more physical thing, like a wheelchair. Okay, you want to do a physical event, an event related to physical mobility or exercise and all those stuff. And luckily though, they like this idea, and they fund our project. So once again, it's a very small, tiny pilot study, and we're trying to assess to see whether it's feasible to do it in a video kind of virtual coach guide expressive writing program for facilitating grief resolution in adults with spinal cord injury. Honestly, tell the truth, when we submitted the grant, we didn't think about using the video conference using Zoom, but once we received the grant, we hit the COVID-19. We have no choice, and we have to switch it to Zoom, basically. Okay, and that's great, actually. I mean, without that, honestly, I don't think we can get enough subjects to because the original plan is to get people come to UAB and probably just sit in the classroom and then write, and that may be too kind of ambitious to get enough subjects to do that. And the duration is not short. I mean, it's 10 weeks on a weekly basis. I think that the commitment may be too much, for a lot of participants if they do need to come physically UAB. Anyway, this study is use a one group pre-test and post-test design with 1 month follow-up to examine the effect of adult with spinal cord injury of a 10-week coach-guided expressive writing program conducted through Zoom and either individually or in a small groups. And the inclusion criterion is anyone with a spinal cord injury that age about 18, and basically once again, this is not a research study. We don't have a control group, and the writing is pretty simple. And as long as they can write, they can express it, their feelings and emotion verbally or through writing. That would be great. And of course, we're going to do it through Zoom. Then they obviously need to have a computer, a smartphone, but majority of people have it. I mean, that doesn't really kind of, honestly, this is not even considered as an inclusion criterion for most of the participants. Able to communicate it and then able to understand the nature of the study participations. Exclusion criteria, we mainly wanted to have a person who have a non-traumatic spinal cord injury, not congenitals, and like spinal bifidates. And we also obviously they need to have able to communicate it and have at least not severe cognitive impairments or they're blind and or they're not English communicators. And but once again, those criteria is not kind of stringent to exclude any person, honestly. And of course, the last one is exhibit any psychotic symptoms like delusions or hallucinations. Okay, how are we going to recruit those people? Then we have flyers and then social media and then Facebook, and then in different small group of Facebook individual with spinal cord injury or transverse myelitis, and community agency through lectures and word of mouth, and then also we mail flyer to patient in the Spinal Rehab Centers database. Participant, and once again, and since it is not geographically bounded in terms of this study, and we got within a year we got 50 inquiry and from 23 states to express interest in that program, and 31 provide consent form, and then 30 completed the pre-program questionnaire, and 3 people withdraw, and I think majority of those actually they don't even after they sign the informed consent form and after they complete the pre-program, they may have other kind of commitment, and they didn't participate. And I don't maybe one person after participate one session, I think they hospitalized or whatever, and that's why they can't he or she need to withdraw. And one person with spinal bifidates, and of course doesn't meet the inclusion criteria. Okay, that means that 30 minus 4, then there will be the remaining 26 who will be in our study, and then they complete all 10 sessions of expressive writing program, and that means about 26 at the baseline, and 2 didn't complete the post-program assessments, and additional 5 didn't complete the 1 month follow-ups. And the procedure is mainly just that the people contact us, and then contact the program project coordinator, and then after getting informed consent, pre-program evaluations, and at that time actually they back on the beginning of our study is we just do it paper and pencil with questionnaire. We send them kind of the paper copy, and I think that's mainly some of the reason why some people maybe the mail get lost, and that's why we didn't get the response. And then but after that we after a while that we changed it to Qualtrics, and but by that time that it's not that common and to use the Qualtrics to collect the data. That's why some of the people who didn't respond post program evaluation of 1 month follow-up, it may not be because they don't want to, maybe just get lost, their return questionnaire get lost in mail. After a set of 3 participants and after 3 people complete the pre-program questionnaire, and the program coordinator will send those named to the writing coach, and then because we at the beginning, as I said, we changed a little bit. At the beginning, we wanted a group of a group of 6 as an in-person, but as I said, and because of COVID-19, we can't do that. And at the same time, we find that there may be too much. And while at the time when we wrote the grant, and then but after that, I think 3 will be manageable, especially through Zoom. And that's why we are using kind of a group of 3 at the beginning, and then writing coach then contact the participant, and then set the time that are convenient among all 4 people, and sometimes can be challenging because they are in different time zones, and but once again, it's flexible. This is not a randomized control trial, and it's only an exploratory study, and our group format is pretty flexible. If 3 of them cannot be 4 people cannot find a common time to meet through Zoom, then the coach decided to, okay, maybe 2 or even 2 and 1. One is individually do it, or all 3 participants do it individually. Once again, it doesn't really matter in this particular study. And then also the coach is very flexible to accommodate the participant in case that a certain week and one participant unable to meet because of their other commitments, or maybe there's a doctor's appointment, things like that. And then the coach will kind of meet with the particular participant individually, and then so that he or she will catch up for the next group meetings. Okay, and our data collection is basically from mid-January to mid-February. And how do we develop this 10-week programs? And then we basically it's based on the Dr. James Pennebaker's and seminal work on confronting a traumatic event towards an understanding of inhibition and disease. And this is kind of his seminal work in, I think, 1984, something like that. And how he did it is he's a professor, and he have a group of psychology students, about, I believe, about 46 psychology students. He randomized it into several groups, and then in his end is one group is writing trivial things. Okay, just like, once again, as I mentioned before, writing about your living room, writing about what describe the shoes that you wear, things like that. Is basically very neutral things. Nobody will attach your feelings on those stuff. And then the other 3 groups is, one group is talking about, ask them to write about the feeling associated with their traumatic events, maybe the loss of the cats or loss of the parents or something like that. And then the other ones are writing about the traumatic event itself, and kind of the factual stuff. And then the 3rd group is a combination of the factual information as well as the emotion or the feelings associated with that. And at the end, the most remarkable result is that because they're students on campus, he followed them up through through the health center surveys that they visit. I mean, as you know, at that time, most of people, if they're sick, then they need to go to see a doctor who will be on campus rather than going to other places. That means it's pretty accurate in terms of their health status. And then 6 months later, and he pulled all the students, all these 46 students, information about their health visit to the health clinics on campus, and surprisingly, and he found that people who are in the combined group, that means writing about emotions as well as the factual information, their visits less compared to the neutral kind of trivial condition, and that's why this seminal work. And since then, there's a lot of people replicate that. And the writing is basically ask the student to be in a room and then writing for 15 to 20 minutes about, once again, either trivial stuff or the emotion or the factual related to the traumatic events, or a combination of both. And also for our study, we also look at his book, Expressive Writing, Words That Heal, and as well as other information from any kind of people, both even in the internet, to look at the systematic writing program for facilitating grieving process for bereaved adult. Doesn't have to be a traumatic event for themselves, but it can be the loss of the loved ones. And the two artists or coach will be Elizabeth and Salam, that they really help in developing these programs. And the program is basically using different forms of writings and poetics, affirmative, transactional, structural, around emotional disclosure, quantitative appraisals, benefit findings, and looking at the future, as well as the reflections. Okay, and normally each session that the coach will introduce one of the theme, and then ask them to just write for 20 minutes, and then after that they will do the reflections, and then they can either share or not sharing in that sense. And then once, sorry, I think once again, most of the people can do it easily, handwriting or typing or using the stylus. And I mean, if worse comes to worse, they can using the speech to text. I mean, once again, with the technology right now, I mean, that's really amazing to be just transcribe all those stuff instantly. Yeah, and that doesn't really have any barrier for them to express their feeling in writing, basically. The 10 weeks is, once again, originally we thought we just kind of replicated Dr. Baker's just asked them to write it, but it seems like after we have done a little bit of pilot, and then seems like there's a little bit too much, too fast, and then wanted to get the since this is not just you ask them to sit in a room and write, because they do have interaction with either with the other participant or with the coach. Okay, that means at least they're not. I have to say, I mean, they're not extremely, they're not 100% private in that sense. I mean, they do share things, they do at least to the coach. Okay, that's why they wanted to after the pilot study, the coach decided that we do need to make a minor changes, and then to ask them to kind of introduce themselves, and then as well as the coach introduce herself, and then that's why the first two sessions mainly writing about the current life situation, just so that to kind of give them a little bit of time to familiar with the other group members, as well as feel comfortable to write and talk. Okay, in the group settings, or even just with the coach. And then the third one is a kind of dive into the emotional disclosures, and then one basically similar to what Dr. Penderbaker's did. And then other things that we also added will be the cognitive appraisals, and then we ask them to address the question like a participant will write respond to this question. Just give them basically give a punch, and so they write it again. What does having a spinal cord injury mean to you? And then later on, we also ask them what challenging have you overcome. And then the week 6 will benefit finding, and then week 6 and 7. And then we also ask them to say, what have spinal cord injury taught you? And are there ways that in which you can use your experience to help others? And also we, on the week 8, looking into the futures and then write about the changes that the participant would need to make to feel a negative emotion or more happiness and joy. Yeah. Week 9, then there will be writing about how have you deal with this trauma, and then week 10 will be kind of the wrap up, and then the reflection of this 10 week, and then of course they can share or not share, and every of those after each session, at the end of after they spend 20 minutes writing, and then they will do a reflective writing as well that at the end of each sessions, and then they can either share or not sharing. Once again, the coach also encouraged them to write after the session. That means after finish the Zoom meeting, and they have another basically the rest of the week to write, and if they want to. And then once again, we talked about that already. And I can share some of the poem that the participant did. For example, this one, I had them to write something related to challenges that they overcome. They say, "Here I am again. Don't ask where I have been. I try to drive again. I suppose it's easier than being paralyzed and trying to put on tadpoles. And the stair to get into church reminds me of what the stairways to heaven must be like for anyone in the wheelchair. It makes me want to pull out my hair. Curbs are challenging to get over to. Hills are challenging too. People's attitudes about what I cannot do is more difficult to overcome, and it may take all day, but I will find a way to change how they see me. They were wrong, and I will be singing a new song." I mean, that's very powerful for them to express their feeling, and sometimes they even draw. Okay, they even draw. I mean, as you can see in here, there's a wheelchair, and then they're fading. I feel like I'm fading away. Then it's okay. I don't see any wheelchair anymore. Okay, and then the last one is the reflection, as I mentioned. They finished the quote unquote their writing, and then they also reflect on what they wrote. And then one of the participants said, "I find that most of my emotions are those that try to communicate those inner thoughts that I cannot be understood by those outside of my situation or disability." I don't know if it's true. While my disability is a clear cause and factor of my feeling, I do not believe that they are unique to a person with a disability. And I see much worse in others, and their actions prove that I am not alone by far, and by sharing what's in my head feels that others could connect if they switch the disability to their own problem. Maybe it's affirmations. I seek to know that I'm not alone. However, knowing oneself is small comfort if it helps nobody but myself. In the end, I try to express the pain or the anguish, but still find the joys and positive despite what life deals me or us. Okay. Once again, it's very powerful for them to find out that they're not alone, and also to show that their feelings. Okay, then once again, that is the program, and then of course we want to evaluate to see whether how how it works, and then we can't do the way as what Dr. Pennebaker is, and because they are not students, we're quote unquote need to control with their quote unquote their health care informations, and especially now through Zoom, and but we do wanted to just at least do a pre-post and a 1 month follow-up at least to see how they respond to some of the psychological measures. Okay, one of those, of course, is a primary measure is related to the grief and loss. Okay, that means that we ask them to complete this complete this 9-item measure that related to the emotional reaction in the past 7 days, and related to grief, and that means that the anger, guilt, anxiety, sadness, and despair, and once again, just a kind of psychological measure. This is checklist. Check the rating. The higher score reflects the higher degree of grief and loss. Okay? And then we also have a whole bunch of other measures, and we also include another 9 measures. Once again, because it's exploratory, and I don't know kind of which how this program will help them, so that I try to find lots of different measures, different constructs to see which will help them through this program. And the other one is called the impact of event scale, and that's basically measured that distress related to different difficulty, and emotional distress. Basically, this is the depression scales. Okay, and it's, most of those instruments are kind of borrowed from the PROMIS, and have been used for people with spinal cord injuries. And as you can see, most of the instruments that I choose deliberately to find those with a very short number of items, and no more than 15 items for each scale. And another one is a very well standardized instrument called perceived stress scales. Okay, and we also include 2 sleep scale. One is sleep disturbance, and that is related to the sleep problem or quality. The highest score of all those instrument that I mentioned from 1 to 5 is the highest score. That means the greater problem related to depression. In this particular case, related to sleep. And then the next 5 is related to kind of more positive. That means that this the number 6 with sleep impact. The highest score is related to less trouble in falling asleep. Same thing as a meaning and purpose, and self-efficacy for managing chronic conditions. Okay, and once again, as you see, that the number of items is not large. I mean, less than 10 items. And number 9 is ability to participate in social roles and activity. And number 10 is satisfaction with social roles and activity. Altogether, even with 10 different scale, and we only at the end it's only about 71 questions. That means that's very kind of doable and not burden to the participant at all. Yeah, and we have 2 primary hypotheses, and the first one is would that be all those show that any immediate improvement after the program of that writing program? That's the one hypothesis. The second is any kind of delay effect, and probably what we can also call it a sustained, a little bit sustained effect after 1 month follow-up, see whether compared to the pre-program, basically compared to the baseline score. And since this is the sample size is not large, only 24, and some of the differences in pair of outcomes are not normally distributed, we decided to use a non-parametric statistic and Wilcoxon sign ranking test and to analyze the data. And since we expect that they all should be improve. I mean, I don't believe that based on the meta-analysis and in the last 35 years study, none of the studies showing that there's the outcome will get worse, and that's why we pick as a one-tail, one-size statistical test, and with a p-value set at 0.5. And because of exploratory nature, then we are not going to control to adjust the p-values. And secondary hypothesis, we also collect other data, and then we also collect data in terms of the demographic information, and that means some people are within 5 years injury, some of those are beyond 5 year injury. Then we want to see whether the program will benefit more to people who are within 5 years or beyond 5 years, or there's no difference, and we don't know honestly. I mean, this kind of almost is an ad hoc post hoc analysis, and to do that. And then the second one is related to whether they are in the groups, kind of a group setting, or versus individually work with the coach. Which one will be better in terms of formats? Which kind of program format will benefit more to the participant? And then once again, it's a post hoc analysis. We use a man weakness U-test, and then the significant level is the alpha level is set at 0.05 two-tail. Okay, the result. And the mean and the standard deviation age it will be 51, and standard deviation 12, and then the range is from 34 to 76. Is kind of wide range. I mean, as most of the study, since we didn't control the age, and then the injury is also range from about 1.5 years to 52 years, and the mean is about 17, and 6 participants within 5 years of injuries. That's why we at the end we can play around with it, and then to see whether the program will benefit more to those people within 5 years, or no different from those within 5 years compared to those beyond 5 years of injury. Okay, then the actual result detail will be the majority of those are female as expected, 70%, and the white once again is almost 80%, and marital status and about 37.5 are married, and equally split between divorced and never married is about 30%, and living with somebody even though they're never married or divorced, but majority of them 80% are living with someone, and sometimes necessary because of the disability that may need some assistance, or other times it's just they want to be quote unquote less lonely. Majority of them have a highly educated. They have some college education, and I think 1 or 2 have a PhD in educational psychology, and employments, and majority of those kind of half those are quote unquote half of those are employed, the other half are disability, receiving disability assistance. Okay. And in terms of the diagnosis, and 75% of those participants have a traumatic spinal cord injury, and then 4 have about 17 have a transverse myelitis. Level of injury and kind of almost split it between paraplegics and quadriplegic, about 12 and 10. All 24 participants complete 10 sessions, and then because of the dedication dedication of the coach, and they just kind of make up the session if in case anything have unable to meet, and then that's why we are able to do for them to complete all 10 sessions of the program, pre and post, and then once again 19 follow-ups. And 3 cohorts have the 3 participants, and then 4 have the two groups, and then the rest of those individual. Once again, look at the data, and then there's a pre and post program comparisons, and in the outcome, and we show that there's a decreased statistically significant decrease in grief. Once again, the first 5 of those were negative side. That means you wanted as a researcher, we expect that there's a decrease. Okay, that means from pre-test to post-test score. Okay, that's good. That means it's showing improvement, decrease the grief, and at the same time, the sleeping impacts to the rest of the other 5 is we expect them to show the improvement. That in this particular case, it show improvement in terms of sleep. Easy to fall asleep, less difficulty to fall asleep. And then we also show the improvement in terms of self-efficacy, participation, and satisfaction in social role and social role and activity. And this the last column is the effect size. Anything that between 0.3 to 0.5 is a medium effect size, and then they all have shown that medium effect size. And the other one is compare the pre-program and 1 month follow-up, and the grief and the sleep impact also show improvements in that. Basically, sustained what they have done before. The grief is maintained to be reduction in terms of severity, and sleep also showing that they are maintained more easy to sleep after the compared to pre-program, as well as sustained after the program. And then we also have 2 new variable that show different improvement is the impact events, the stress, and the meaning and purpose. And basically, the summarize is the 2. They show that medium effect size improvement in grief reductions and trouble falling asleep, and then other finding will be greater confidence in managing the chronic conditions, less trouble in social role activity, and greater satisfaction in social role activity. And at 1 month follow-up, that we observed that the delayed improvements in reduce the stress, and also increase the meaning in and purpose in life. And compared to the 5 years, and within 5 years, and beyond 5 years, pre-program and post-program, and it shows that the impact events, the distress is a benefit more to the within 5 year participant, and also participation in social role activity. And that means that those 2 variable go better compared to the one who had a spinal cord injuries beyond 5 years. And once again, the effect size is medium. And we also compared the pre-program and 1 month, and the both impact, the distress, and also the participation is basically maintained, and the depression, sleep, impact, and meaning and purpose, and also show the one that was for within 5 years is gaining more compared to the one with beyond 5 years. For the group versus individual coaching, and we didn't find much. And out of those 20 variables, we only find one at the pre-program and 1 month follow-up with grief and loss, and it may be we may commit a type 1 error because of that. But that's not, to me, that's not too important. And then once again, our difference from original protocol from Dr. Pennebaker is we do have interaction with the participant, and they're not alone. They're not alone versus group. They are one-on-one with the coach and versus a group with the other participant and the coach. Okay. We also do some qualitative analysis, and then interview them, and then at the end, and then we find that some of those themes, mainly is cathartic experience, acceptance of life, and self-efficacy and empowerment. We're trying to write those up and for publication, but we're going to skip that, and then as we run out of time. And discussion, and basically we find that the express writing program is feasible channel through which therapeutic benefits of expressive writing can make accessible to the spinal cord injury participants, and it's a good outlet for them. And all those study, our study also consistent with previous study in that sense. And I think those are basically what we wrote. And I wanted to just in the last kind of reminding one more time is the post-hoc analysis. We find that the more recent injury participant seems to benefit more, but at the same time, also thinking about they may not be ready. Maybe, I mean, we don't know. I mean, that's kind of a little bit caveat to that. Once again, the group and individual, I don't think would be of important because of we do have a coach. And conclusion is that the program writing process help participants confront and rationalize the past, make meaning of the loss, and accept the injury-related limitation, and seeking new norm for themselves. And I think that's will really help them to kind of reduce the severity of grief and then cope with the rest of their life, basically. And once again, there are some limitations, exploring nature, and we don't have any integrator agreement check have been to do to related to the two coach, the delivery of the sessions, and majority of those of the participants are non-white women, and that may limit the generalizability of the study finding. And then, of course, we acknowledge our colleague with the two coaches, Elizabeth and Salam, and also Lawrence and the study coordinator and field to help me to kind of put this grant together, and Dr. Chandler for doing the recruitments. And